Okay, according to figures released this year by the Office for National Statistics, there was an overall total of 200,605 abortions for women resident in England and Wales. It was higher with non-resident abortions. But that number makes it the highest since records began in 1974, and it marked a 4% increase on 2017. Now, roughly translated, these figures mean that under the terms of the Abortion Act 1967, around 4,000 unborn children are legally killed every week, which translates into around 530 terminations every 24 hours and around 22 babies every hour. Now, perhaps even more shockingly, since the Act was passed, the British Isles have seen in total 9 million abortions. Now, to put this into some kind of perspective, our population currently stands at 66 million, which means that in the last 70 years, we have legally killed around the equivalent of 14% of our population. Put it another way, the number of abortions that we've carried out here in the UK since 1967 would be equivalent to killing the entire population of Austria or the entire populations of Ireland and Singapore combined. Isn't that amazing? It's horrific. Some more figures. In 2018, there were 657,076 live births recorded in England and Wales. Now, when you set against that figure the 200,605 recorded abortions, this means that last year, 1 in 4 pregnancies ended in termination. I think that's utterly appalling. But the implications actually are so much worse than even just looking at that superficially. Because in order for the population of any country to survive, replacement level fertility requires an average of 2.3 children per woman. Do you know what our current reproduction rate is? 1.7. I heard somebody say that, but I'm not sure where it came from. We are currently at 1.7 births per woman, and it is falling. What this means is that the indigenous population, British population, is moving towards extinction. And the stark truth is that unless things change dramatically over the next few years, by 2050, the UK will face a major demographic shift that will lead to possibly unsustainable cultural, political, and economic change. We simply don't know what the repercussions will be from this. But as a result of the damaging effects of birth control policies, that same situation is being repeated worldwide. And we've seen it very obviously, for example, in China, where results of the one-child policy seriously destabilized the population. It led to very real fears of civil unrest and violence because they had so many young men running around with far too much testosterone and no wives. They've had to change their policy. This is a global problem. Now, before 1967 in the UK, abortion was regulated by the Offences Against the Person Act, 1861, which made it an offence to administer any poison or noxious thing or to use any instrument with the intention of procuring a miscarriage. Now, this applied both to a woman trying to abort her own child and to anyone trying to help her. And the penalty was penal servitude for life or for a period of not less than 3 years. But actually this was never a total prohibition. The Bourne case in 1938 had ruled that a doctor could lawfully carry out an abortion where there were reasonable grounds for belief that the continuation of pregnancy would leave the mother a physical or a mental wreck. So even before 1967, an abortion could be legally performed on the NHS where there were serious and substantiated concerns for the mother's health. Now, not many doctors at that time would agree to give the necessary certification. So many women, the only option was to seek help from the notorious backstreet abortionists. And that's probably self-explanatory what that means. Now, advocates for abortion, both then and now, have long maintained that the highest cause of maternal death prior to 1967 was injury sustained at the hands of unqualified women carrying out these sometimes horrific procedures with coat hangers, with knitting needles, with bleach, gin, hot baths, whatever. A whole list of things. But the claims were actually very greatly exaggerated. And some of those who perhaps might be seen as a shade uncharitable amongst us might say they were deliberately distorted. When the Liberal MP David Steele proposed his abortion bill in 1966, he claimed that there were between 40,000 and 100,000 illegal abortions a year. Now, it is actually absolutely impossible to verify these figures and to get at any kind of exact number. For a start, something that took me by surprise, the yearly numbers recorded as abortion included miscarriage, and somehow all this got jumbled up together. A lot of pregnancies end in miscarriage today. But where there was an illegal abortion prior to 67, a doctor was only ever called in where there were untoward symptoms. I mean, let's face it, you're not going to call in a doctor otherwise, are you? So in other words, the doctors only ever got to know where there had been an illegal abortion, where something had gone wrong. But records of medical intervention where this happened are actually relatively low. You can go and check this for yourself. Now, campaigners, both then and now, say that the doctors falsified their records in order to protect women from prosecution. And I'm sure that went on. But in evidence into the Burkitt inquiry into abortion in 1937, the Midwives Institute said that in their opinion, the number of illegal abortions was low, because most working class women faced with an unwanted pregnancy, whether they were married or not, they just went ahead and had the baby. Now, these ladies were on the front line. So you might expect that they possibly had some idea what they were talking about. So who do you believe here? But logically, what this means is that if the numbers for illegal abortions were anywhere near as high as claimed, a very large number must actually have been highly successful. Because there wasn't a problem, the doctor wasn't called in, and these women went on to have more children. There's a disconnect here, isn't there? This doesn't actually fit the argument at all. So the question is, what was really going on? Now, it's also worth pointing out, before we just look at some of the underlying agendas here, that before the advent of penicillin and improved hygiene, mortality rates for all patients were very high. In the early 20th century, this would inevitably have included women undergoing so-called backstreet abortions. To put it bluntly, you would have expected there to be a high number of deaths. But what campaigners significantly failed to mention was that at that time there was an equally high mortality rate for women undergoing legal abortion in hospital. So again, the arguments were skewed. Dr. Peter Saunders actually wrote an extremely interesting short article on this point. How many women really died from abortions prior to the Abortion Act? And he made the point that survival rates, whether in a hospital or in someone's back room, were directly related to standards of hygiene and infection control, so that once medical care improved, the high levels of maternal mortality from all causes, whether we're talking legal or illegal, began to fall dramatically. But he makes the point that this had started to become evident long before abortion was legalized. So the argument used by campaigners for abortion reform that women had to be reformed so that women could receive proper care without fear seems to me a little bit disingenuous. So if that's right, what is going on here? And why was legalizing abortion so very important? Well, I would suggest that this is where things start to get really interesting. The population control movement, which later morphed into the call for birth control and abortion, was started by a clergyman, yes, you heard that right, an Anglican vicar in the 18th century, Thomas Malthus. Now, Malthus believed that for the world to avoid famine, disease, and war, because there are only limited resources, the population had to be kept under control. And in particular, he said the poor, who were a drain on world resources, had to be kept from breeding. Sounds quite shocking, actually, doesn't it? He inspired a group of radicals, the Malthusians, led by Charles Bradlaugh and Annie Besant. And this pair wanted to improve the human race by promoting the survival of the fittest. And to achieve this, they began to advocate that contraception be given to the poor. They were very quickly followed by another group who were known as eugenicists. I think these are probably starting to connect in your brains here. Eugenicists, same kind of broad aims, but they wanted to encourage marriage between the physically and mentally fit and to stop marriage between people they labelled undesirables. To achieve this, they advocated segregation, birth control, sterilization, abortion, euthanasia, and extermination. This was the exact program we saw taken on in Nazi Germany, and it led to ethnic cleansing. Okay, back to the UK. Over time, these two groups, Malthusians, the eugenicists, they got merged. But the underlying motive for both was a belief in the perfectibility of the human race by eradication of the unfit, the degenerate, and the poor, who are a drain on society. I don't know about you, but I think I might have been one of those labelled fit for extermination. In 1936, the Abortion Law Reform Association, ARLA, was started to campaign specifically for abortion in this country. And you know what? All the founder members were eugenicists. And they were supporting abortion as a method of improving the human race. And the same is true of our wonderful feminist hero and saint, Mary Stopes. Early pioneer of birth control and abortion, women's rights, woohoo. Yes, her family planning clinics were always clustered in deprived areas, but she was not campaigning for women's rights. She was not campaigning to help the downtrodden poor. She wanted to stop the unfit from breeding, and she even lobbied Parliament to pass laws to make sterilisation compulsory in order to ensure the sterility of the hopelessly rotten and the radically diseased, and she included the poor in that, by the elimination of wasteful lives. Her expressed aim, her whole motive, was to prevent the birth of the inferior, the depraved, and the feeble-minded. And she didn't like people half-caste either. She said they ought to be sterilised at birth. And perhaps unsurprisingly, do you know who her hero was? Adolf Hitler. She adored him. She even wrote love poems to him. So this is the background to abortion. Nothing to do with empowering women and respecting their sexual rights. Everything to do with eradicating the inferior, the feeble-minded, and the poor. Nice lady. Today, abortion liberalisation is still actually not about women's rights. It's about money. It's about big business. It's about population control. The truth is that for the last 70 years, women have been victims of a global con. And that's still going on. And because of that, it is no exaggeration to say that we are facing global disaster. We are literally killing off the human race. Wherever in the world there is mass provision of contraception, and wherever abortion is hailed as a female right, we are seeing this alarming decline in fertility with its absolutely catastrophic results for the population. And let me tell you something interesting. The only countries where this terrifying decline in fertility isn't happening, and where there are still high fertility rates, are those countries that are classified as poor and underdeveloped. They need our help, guys. So let's go and give it, especially Bill Gates. Niger, reproductive rate of 7.153. Somalia, 6.123. Angola, 5.589. Uganda, 5.546. It goes on and on. I actually wanted to show you the whole tables, but there are pages of it. These are really healthy reproductive rates. And it's these countries that the UN is targeting. These countries that Bill Gates says that women have an absolute right to contraception and abortion. Because they need to have a better life. Really? Nothing is being done to help countries at the other end of the list to stop population decline. Look at this. Russia, 1.7. Same as ours. Actually, it gets worse than this. We need help. More birth control and abortion does not empower women. It does not help gender equality. These are lies. And it is not going to alleviate poverty in Africa. In fact, all of this only makes women more vulnerable because it weakens marriage and the family. And the same will happen in Africa if these programs are rolled out there. The same will happen there as is already happening here in the West. In this country, we really don't need to legalise abortion on demand up to birth. You know what? We already pretty much have that anyway. Abortion up to 24 weeks, which is a time limit, is way beyond viability. And its viability up to now has always been recognised as the cut-off point. Can this child exist independent of its mother? If it can, then it's a human being. Hallelujah. Abortion reform, however it is dressed up, is not about women's rights. It is about profits for the abortion industry and about weeding out undesirables who are going to affect the rest of us, the vulnerable, the disadvantaged. It's about controlling the global population so that the dwindling numbers of us left here, we can enjoy our affluence without threat from them over there. Friends, this is disgraceful. It is surely time for this hypocrisy to end and for the right to life of the unborn to be upheld. Thank you.